prestigious institutions, faculty, invited guests. I am really happy to be with you today morning. I have been asked to talk about changing the tides, and I have thought that why not to combine the medicine with management skill which you are pursuing here. So I will go through how we cardiac surgeons somehow take the little bit help from management to carry out our work smoothly. Friends, when we go into the medical school, we are not being taught as you get a first lesson which is mentioned here. We learn these things while we pursue our career and grow in the life. Now this is a very important aspect. I am going to talk my things in these three columns. The one, the past is behind, learn from it. We medicos practice evidence-based medicine. So we never forget the past. That's a very, very essential. Then the future is ahead, prepare for it. Generation next has to be trained by us. They are going to be smarter than us, but nevertheless we have to prepare them for a future. Then the present is here, live it. That's what I am also going to give a pinch of that, how we are practicing cardiac surgery today. You all know that cardiac surgery can be done either on beating heart, or we can do the cardiac surgery when arrest the heart, go inside and operate. Now doing beating heart surgery is easier, and this has been pursued in early 20s. In Massachusetts General Hospital, they did a first stenosis mitral valve with the finger fracture. They also did a closure of patent ductal arteriosus. This was easy, but to pursue open heart surgery is difficult. Why? When we have to enter inside the heart, we have to stop the circulation. While we are stopping the circulation, the brain is not going to get oxygen and nutrients. If brain divide of nutrient and oxygen for a couple of minutes, there is a gross damage in the brain, and sometimes it may not come back. So surgeons start thinking how we can protect the brain while we are doing open heart surgery. When we do open heart surgery, we isolate the heart and lung, and rest of the body including brain, kidney get circulation with a machine. What we call is a heart lung machine or bypass machine. So the surgeon started thinking what we can do to save the brain and rest of the body while pursuing intracardiac open heart surgery. Now in Alchemist, Paulo Coelho has written that when you want something, the whole universe conspires in helping you to achieve. There was a collaboration between a cardiac surgeon and engineer to develop a heart-lung machine. The first heart-lung machine was tried and developed in General Motors by an engineer who was supposed to manufacturing cars and trucks. This was the initial inroad in developing some form of brain protection machines. After that, there were certain other modalities were tried. The one was immersing the body in ice cold. When we immerse the body, you know that our Rishi Munis who are in the high Himalayan range, months together they don't eat. They live because of the requirement of food. Energy goes down when you are in a zero temperature or close by. So this is easier if you can immerse the body. The temperature goes down, the requirement of oxygen and nutrients becomes, but then this is very tedious to carry out heart surgery, hence this process was abandoned. Then subsequently the heart lung machine came in picture. The C. Walton Lilhey from Minnesota, very famous heart surgeon tried cross circulation. What is a cross circulation? Mostly the babies who are born with a birth defect, their parents work as an oxygenator, and the unoxygenated blood goes to the parents and then return as a purified blood to the child, and this was known as a cross circulation. But eventually this was also not very active, hence the heart-lung machine was the one. What had happened in fact, that Dr. Lilly operated a patient in 1954, patient lived 67 years, he died in 2018. Family gifted the body to the hospital to study what kind of surgery was done, and hospital was gracious enough to do the 3D printing of that heart and gifted back to that model to the family. We now today utilizing 3D printing to study anatomical defect in the heart and hence get some idea how to repair the defects. In industry this is being used since long time. Now medicine is started using these 3D printing. Dr. Lilly, while he is operating the patients, the 100th patient, while he was coming off the pump, patient did not gain the rhythm, he had a heart block. Now this was a condition where patient cannot revive, patient died. Eventually the Lilly collaborated with engineers and they developed what is known as a pacemaker, external pacemaker, big machine, and hence they started helping the patient to gain the rhythm. Eventually there was a leaps in this technology, and today we have implantable leadless pacemakers, and there is so much development in this technology. Now, between 1950 to 1970s, there were experiment, innovation and application in cardiac surgery. The diagnostic modalities in form of echo, ultrasound, X-ray and of course angiography developed. Heart-lung machine came to picture. There was refinement in the surgical techniques and technology. Vascular prosthesis, heart valve prosthesis developed, and there was ancillary services which were being modified like anesthesia, nursing and physiotherapy to suit heart patients and their recovery. Now I completed my post-graduation in general surgery in 1984. During that course of post-graduation, I was given a thesis topic which was diagnostic value of upper gastrointestinal endoscopy. And also I was involved with laparoscopy to peep inside the abdomen to see any diagnostic modalities available. Hence, I got interest into the keyhole surgery, and there was the era when the general surgeon started doing lap chole. With the help of laparoscope, they used to remove the gallbladder, remove the appendix. So I got immense interest in the keyhole surgery, but my passion was heart surgery, and the heart surgery was being done like this. Big incision. There was no scope at that point of time for a keyhole heart surgery. So the dilemma was what to do. Like one has to pursue the capitalism or go to the socialism. That was a time when there was a Rajiv Gandhi and Gorbachev agreement in science and technology. I got opportunity selected by Medical Council of India to go for my postdoctoral course to the Moscow, very famous Bakulev Institute of Cardiovascular Surgery, Moscow. I went there. This was the time when I learned the lesson of endurance and adaptability, because the USSR or present day Russia has got a very harsh weather. All around you can see the snow. That was the point when there was upheaval in the government system. There was strike, and I could able to see the superpower coming down to the rocks. Now that was a really difficult time, and I could able to learn that and how to survive in those untoward situations. But besides that, I got opportunity to travel the Europe from Moscow by train all over to the Paris, to London, go to Gage Hospital London, go to Hospital Bruce in Paris to see how the Westerners are different from the East Bloc. And that was the real opportunity to have a massive input. I am privy to when the first time the West Germans allow East German to enter to the West Germany without a visa. That was 31st of December. I was also the part of that crowd, and I see the people from East Germany holding the champagne and cheering up. So that was the time when we were seeing what is changing, political system is changing, and also the cardiac surgery was taking a solid footage. Now, in 1991, the India started having economic revival. There were a lot of changes happening. India started becoming economic power in rudimentary things, and that was the time when I was supposed to come back from Russia after completing my course. There was a corporate involvement. Corporate was putting the money for tertiary heart centers, the pay package increase, there was affordability for a newer technology, and globally there was a strong foundation for cardiac surgery. So there were, instead of brain drain, there was a brain drain. A lot of people, they were start to come back because of these changes in India, and I was the one who came back. And I joined the Escort Heart Institute headed by Dr. Naresh Trehan, who was the very famous at that point of time. This was the biggest cardiac setup in the world. That's how I persuaded and got a foothold in India. Now we see that the cardiac sciences has got a multiple interdependent specialties. Now because of these independent specialties, there is more scope for technology, business, training program, research and innovation, because each subspecialty has to have all these domains. Hence there is a combined effect of great business model and lot of involvement of the capitals, and which was happening in our country. Let's see what are the innovation, how my dream was fulfilled, because I was interested with the keyhole surgery. So between 1996 to 1998, the surgeons across the world started thinking, can we do the heart surgery without heart-lung machine, without splitting the sternum? And that was actually the passion met with love for me. And what had happened? Eventually, in 1996, an Italian surgeon, Dr. Calafiri, visited Bangalore for a meeting. He was the one who started keyhole coronary surgery. I got a video from him. We practiced. I got opportunity to go to Oxford and have a one-to-one discussion with surgeons across the world, and we started doing keyhole beating heart surgery. We did 40 cases in 1 year, and we published our landmark paper in a European Journal of Cardiovascular Surgery, and we showed our results. Now, maintaining the integrity of bony cage is very, very important. We did with this kind of surgery for coronary, but we also started doing valve repair and replacement like these small key. When we gained experience, we started spreading this training program to inside the country and outside the country, like Bangladesh, Nepal, Thailand. A lot of people started coming for our skill courses. Now, these surgeries were done without industry support. There was no stabilizer, no instrument. Eventually, the industry started supporting. We got a tissue stabilizer. With this, we did 14,000 beating heart surgeries. We presented our result in 2005 in New York, Million Energy Society, and eventually we published that landmark paper. So the skill alone is not enough, and equipments are equally important to pursue this kind of modern surgeries. I give an example. One software engineer, he had aortic valve problems. He went to his superior and said that he needed 3-month leave, because most of the times cardiac surgery means 3 months leave. But he said, no, you have to rejoin in 3 weeks. He somehow came to know about my process, which is going on, minimal invasive surgery. We did a keyhole aortic valve replacement, and exactly in 3 weeks' time, he was back to work. And this is kind of incision which he got. So friends, with this, we all know that robotics are being used in the industry, in the battlefield, in the space, but the robotic in cardiac surgery came much, much late. First time in 1998, intuitive surgical design Da Vinci, which was used in Paris and in Germany, and surgeons did a bypass surgery and intracardiac surgery. The problem with the robot is that in our country it's a very expensive venture. This costs around 16 to 18 crore rupees. So what had happened? Now we have now the Indian made robot, which is a revolution. Mantra system, SSI mantra system is being made, and this is Indian story. You can see that the surgeon sitting in this kind of room in a conference, operating the system while the work is being done in the lab, tele-mentoring and tele-support. Now this is a system which is going to revolutionize the whole robotic technology. Now in India, a lot of people are dying because of terminal heart failure. The best treatment for heart failure is heart transplant. But we all know the number is huge and donation is very minimal. So how to take care of these patients? Now if they are not responding to drugs, there is a repeated hospital admissions, we have to do something, and this is the way. Now there is a ventricular assist devices, mechanical circulatory support is available. This is a patient, 14-year-old Iraqi guy. His sister was admitted in Turkey and died there because of the same problem. He came to us in a wheelchair, family was jittery, they were asking, anyhow you have to save the patient. We use this technology. This is a left ventricular assist device. This will be a device till he is going to get the heart. And this patient got this device. He is moving, you see that this is a rotor and these are batteries and the device is inside thorax. He is moving, he has gone back to the Iraq, he is registered in 3 countries, Belgium, Iraq and India. If he is going to get a transplant, this machine is going to be removed. So this is a kind of course this technology is also very expensive. IIM Kanpur and IIM Madras are developing, and there is one private initiative which is coming up. Maybe in a year 2-3 times we are going to have our own LVAD devices. Besides cardiac surgery, now we are also venturing out to what is known as percutaneous hybrid procedures, where we can replace the aortic valve with percutaneous technology. We can repair the mitral valve. We can also replace the diseased aorta intraluminally. These devices are available. We are practicing. We make a heart team where cardiac surgeon, cardiac anesthetist, interventionists, they are combined. They work with these things, and we can do this procedure in high-risk patient who cannot be fit for a regular cardiac surgery. What is generation next? We started training our next generation in a cadaveric lab. This is one of the session in Advanced Learning Center in Bangalore, Ramaiah Institute, where we are training these are the senior surgeons who are being trained with the cadaver in advanced minimal access approaches. We are also now utilizing simulator. This is a simulation center in Singapore, which is best in whole of the Asia. There are a lot of sessions are going on. We enthusiastic heart surgeons form what is known as National Society of Minimally Invasive Cardiovascular Surgeons in 2015. Now what is the aim of this society? To provide a platform in annual and midterm meetings to our youngsters to present their work. Let the juniors learn from faculty all over the world who is coming to these meetings and move on. This is one of the trainee who has come from France. Now a lot of people are coming from developed world to learn from us. This guy came from France, he stayed with us in Manipal hospital for 6 months, and he has gone back. We are going to send our guy to the France to get. So this is kind of exchange program. We had a trainee from Germany, from USA. So our capacity is growing. We have knowledge. We have institution who can train the people from Western world. AI application is big way happening in all sphere of life. Same is with cardiac surgery. We can have error-free diagnostic results. We can have intelligent symptoms analysis. We have predictive and early diagnosis. use of AI in radiology likewise. But friends, is the precision for patient is only important, or they also require compassion? I think our patient, when we communicate with them, what they say, look doctor, by talking with you, half of my misery is gone. So I don't think only precision matters for our patients, they also need compassion and empathy. So friend, there will be innovation taking place in the field of cardiac surgery, cardiology, and this is going to continue because this is dynamic process. The new generation is going to be smarter than us, they are going to bring out something more. But eventually, the lesson of management from cardiac surgeon is an army of sheep led by a lion can defeat an army of lions led by sheep. Thank you very much.